Hello and welcome to our Share and Learn, focusing on type 2 diabetes prevention. We'll start with a Q&A with our staff panel. We have three fantastic volunteers sharing a bit about their volunteering, and then we'll open into some smaller breakout rooms for some discussion. So if I could please start with inviting Joseph and our panelists to come on camera. We'll just pin you and then we'll start with some introductions. If I could start by asking Rachel to introduce yourself, please.
Thanks, Emily. So my name is Rachel Burr. Hello, everybody. Lovely to see you this evening. I'm actually the National Director for Wales at Diabetes UK, so I lead the team in Wales. And I'm also one of the co-leads, along with Helen, who I think you can also see on the screen, for the prevention of type 2 diabetes across the organisation. So nice to be here.
Thank you, Rachel. And Helen, if you could please introduce yourself.
Thanks. Yes. Hi, everybody. I'm Helen Kirain. I head up the policy and campaigns team at Diabetes UK. And I also am the other co-lead of the prevention of type 2 diabetes ambition at Diabetes UK. It's lovely to come and speak to you tonight.
Fantastic. Thank you both for being here. And I'm now going to bring Joseph in. Hello, Joseph. Could you please introduce yourself?
Hello, everyone. My name is Joseph. I'm a volunteer at Diabetes UK, and I'm residing here in North England.
Brilliant. Thank you, Joseph. So if you're ready, Joseph, do you want to kick us off with our panel and your questions for Rachel and Helen?
All right. Okay. So my first question, what are Diabetes UK's ambition as a charity, please?
Thanks, Joseph. Well, I'm going to take this one. Diabetes UK, our strategy, we've got three overarching priorities in our current strategy. One of that is prevention and cure of diabetes. So we want fewer people to get diabetes and we want cures to be found for those living with the condition. So groundbreaking research in prevention and understanding the science behind diabetes is really important for this outcome to be met. This ambition also involves influencing governments to create conditions that support people to live in good health and ensuring people who are at high risk of developing type 2 diabetes have the support they need to reduce their risk of going on to develop the condition. So that's one of our key priorities. The second one is around more people can live well with diabetes, and this focuses on supporting people to through their journey with diabetes, however that might look and regardless of their circumstances. And it especially focuses on ensuring people with diabetes get the support they need at the point of diagnosis, ensuring that all people with diabetes are able to access their essential diabetes checks every year, the 9 diabetes care processes, and their routine appointments following those too. And we're also running a programme for young people with type 1 called Together Type 1, and this is a community for all children and young people aged 11 to 25 living with type 1 diabetes to meet new friends, develop skills and grow in confidence. And then thirdly, and finally, the third key area of our strategy and priorities is tackling inequity and stigma so that everybody is included. We know that health inequalities and stigma are both closely associated with diabetes, and we seek to challenge these injustices and address the barriers that many people with and at risk of diabetes face in accessing the care and the support that they need and to live well with their condition. So that's a kind of a summary of our main priorities. Thank you.
Thank you, Helen. So if I may ask, why is prevention of type 2 diabetes one of our ambitions, please?
Thank you. So an estimated 6.3 million people in the UK live with pre-diabetes, and many of those people are not aware of this. If left untreated, pre-diabetes can develop into type 2 diabetes. Also, between 10 and 20% of pregnant women develop gestational diabetes. This is a form of diabetes that develops during pregnancy and goes away after the baby's born. it can cause complications for both the mum and the baby. And also having gestational diabetes puts a woman at much higher risk of developing type 2 diabetes later on. But with the right support, these people with higher risk, people with pre-diabetes and people who've had gestational diabetes, can often reduce their risk of developing type 2. So our ambition is focused on ensuring everyone that has increased risk of getting diabetes gets the support they need to reduce their risk of going on to develop the condition. In addition, we need to tackle the underlying causes that lead people to being at higher risk of developing type 2 diabetes in the first place. This includes improving our food environment so it's easier and cheaper to access and eat healthy food, and improving the social conditions in which we live and grow up to better support good health and avoid developing health problems. Diabetes UK works with many other organisations to challenge government and industry to make it easier for everyone to stay healthy and reduce the number of people developing health conditions like type 2 diabetes. Thank you.
Thank you very much. So my third question is, what is Diabetes UK doing to raise awareness of prevention messages and then support people at high risk of type 2 diabetes?
Thanks, Joseph. So I'm gonna take this one. So the prevention ambition is really threaded through all of our work at Diabetes UK. So as Helen's kind of mentioned, we work really hard with decision makers to try to develop and try to sort of influence policies and practices that are around reducing obesity at a societal level, because we know this is a problem that's across the whole of our society, but also working with these decision makers to try to ask them to think a bit differently about the language they're using around type 2 diabetes and the way they're sort of framing the issue of the increase in type 2 diabetes, because we're acutely aware of the stigma that exists around type 2 diabetes, and we want to make sure that the people who are making decisions or are making policy are not worsening this through the sort of language and the framing of the issue. So that's one of the things we're doing. We're also working all the time with health systems and with healthcare professionals to try to increase screening for type 2 diabetes, but also to increase and improve the access to some of the prevention programmes that exist out of there and the support for people who might have pre-diabetes or are at high risk of diabetes. So in some of the nations there are national prevention programmes. There's one in England and there's one in some parts of Wales. In other nations, in Scotland and Northern Ireland, we don't have national prevention programmes. But whatever the situation, we're trying to make sure that people have access to the best support possible. And we want that to be in an equitable way as well, because we're aware that access isn't always equal. Sometimes there are barriers for certain groups in the community. And so it's not just about having the programme there, it's about making sure people are getting it at the right time and that everyone has equitable access to those prevention programmes where they exist. And what's also really important to us is that people are able to access the support that we offer. So at Diabetes UK, we have a whole swathe of resources online to support people who are at risk of diabetes, who may be living with pre-diabetes, who may have had gestational diabetes, and also people who are living with type 2 diabetes. And so we want to make sure that people have access to those. We're pulling those all together actually in a hub, what we're calling the Prevention Hub online, which is just a more easily accessible space where people can come and see exactly what we've got available to make sure they can get what they need when they need it. And the other thing, of course, that we have is our Know Your Risk tool, which is a really important online tool where if a person is unsure whether they're at risk of type 2 diabetes, they can come online, they can fill it in, and it'll give them information about their risk levels and kind of give them guidance on what to do next. So we're really trying to make sure that health systems and healthcare professionals are aware of these resources and are signposting people to these resources at the time when they need them most. And with the Know Your Risk tool, we're actually refreshing that this year. So that's something else that's happening. And that's going to include a Welsh language version, which is something that as working in Wales, which is really important to us and a really good step forward. But over the next year, our marketing teams and our communications teams are going to be promoting the resources that we've got, including the tool. And we've got some moments throughout the year which will help us do that. So, for example, Prevention Week, which we think is going to be in June, though it's not definitely confirmed yet. It's a real opportunity for that to happen. And we'll kind of use a range of media. So we talk about it on social media. We'll be using kind of traditional media, hopefully talking about it through broadcast. and online to make sure people are reading and understanding what we've got to offer and are able to access our resources as and when they need them most. And then the other thing that's kind of really important to us is that we're making sure that we're sort of get the insights that we're gathering from people with lived experience are grounding all of the prevention work that we're doing. And when we're talking about prevention and try to raise awareness about prevention, that we're grounding that always in lived insights. And we do that through a number of our committees, such as the Community Organisation Advisory Committee and the Lived Experience Committee. And then finally, the other piece of work that I think is really important to talk about is that in our nations and regions, teams are working with organisations and with networks who are working on the ground and supporting people who may be at risk or living with type 2 diabetes. And through that, we're kind of sharing prevention information to a really wide range of people. And we're doing that in a way that has legitimacy because we're working with groups who already have these connections in place and enables us to speak to people we might not otherwise reach as a charity, who might not be necessarily in our sort of ecosystem, might not know about us. We're reaching these through some of these networks and focusing very much always on the tackling inequity ambition. So trying to engage new groups of people with a focus particularly on those living in areas of deprivation and people from Black and South Asian backgrounds. So that's another piece of work that we're doing.
Wow, that's brilliant. Thank you so much, Rachel. All right, so my final question here is, what can we supporters do to raise awareness of prevention messages and then also to support people at high risk of type 2 diabetes?
Yeah, thanks for that question, and it's wonderful that people are engaged and interested in in how they can support. And we'd absolutely love our supporters to sort of raise awareness of the resources that we've been talking about. We feel that we've got a really great sort of range of support that's available for people, and we just want to make sure that they're aware it's out there. So anything people can do to talk about the resources, to talk about Diabetes UK and the support we can offer would be fantastic. Any sort of signposting people can do to our online resources would be brilliant. And where we've got these moments such as Prevention Week, where we'll be online and on social media, if people can retweet and repost and sort of share the resources, that's a really fantastic thing to do. We've also got a lot of hard copy resources available around the prevention of type 2 diabetes, things like our Eating Well and our Moving More guides. So where volunteers are out in the community, you can share these, or if you're speaking at events, you can have these available, even sharing them with your local doctor or pharmacist, or asking posters to be put on notice boards, that type of thing is fantastic and really helpful to us. We've also got volunteer opportunities such as our Communities in Action role. So either being part of that or promoting that role is really, really helpful. And these volunteers sort of help to shape the work we're doing, giving us input about what it's like to live with diabetes and pre-diabetes with a goal of influencing and driving change to the system. And we've described already just how important it is that we're making sure sort of change is happening from the top down on this societal issue around type 2 diabetes. It'd be really particularly valuable actually to have people who are living with pre-diabetes or who have previously had gestational diabetes. So if you know of anybody in that position, suggesting to them they might want to consider joining our Communities in Action would be a great thing to do. Also worth mentioning, and I think we're going to have a bit of a spotlight on this later, but the diabetes research steering groups, some of them focus on the prevention of type 2, and they definitely rely on volunteers to support them. So that's another consideration. But I think the other thing, and I think all of us in the room can do this all the time, we all have a role, I think, to play in educating society about type 2 diabetes, what it is and what it isn't. There are a lot of misconceptions around the condition, and I think by talking to people, just our family or at work or our social circles, we can try to improve understanding about type 2 diabetes, the risk factors, and where to get support if you need it, trying to break down some of the stigma around type 2 diabetes and some of the myths so that we're just talking more openly about the condition in a way that's more helpful, and that means more people know what to do if they're in a position where they need support.
Okay, thank you so much, Rachel and Helen. That was quite an insightful one. All right, Emily.
Thank you, Joseph. Thank you to Rachel and Helen. That was fantastic. Some really interesting answers there, questions and answers, and I can see we've got some really good questions coming in the chat as well. So we'll try and get to those, but if we don't, we will be sending out a Q&A document afterwards where we can answer some of those questions. So that's fantastic. Well, what I'd love to do now is just to hear from some of our volunteers. So I'm going to first of all share a video from Sarah. So let's hear from Sarah now, who's going to talk a little bit about her experience of volunteering with us.
Hi everyone, I'm a current Olympic champion and also member of the scientific research group as well. I've also helped out a little bit with umpteen different areas of the charity's work over the last few years. I became involved in, I think it was 2021, initially just as a member, put my name down onto your mailing list for volunteer opportunities. Came through literally within days. It was Communities in Action Group. Got involved with a couple of focus groups, which was really interesting. Some of it was around young diabetes, young type 2 and prevention work. I then got involved further. I ended up, would you believe, invited to the professional conference in 2023. Spoke about my experiences, both positive and negative, of having bariatric surgery and my journey as a type 2 patient through that tier 3 system. It really was quite daunting standing up in front of a crowd of healthcare professionals speaking about little old me. But it was really interesting. Everyone was so supportive, so welcome. The team, everything we've been involved in from day one, you get incredible amounts of support, both on a peer level and from the team at Diabetes UK. Since then, I got invited to become campaign champion, visited Houses of Parliament in 2024, again talking about young diabetes for type 2 patients. It was, a lot of it was focusing around healthcare in relation to pregnancy, gestational diabetes, and then diabetes in later life. We're all still in touch. There was I think it was 4 champions went that day. Hopefully a few of you will be on this call this evening. We were all still in touch, all progressing at different rates through our volunteer work. It's been an incredible experience. And then this year, I came on board with the scientific research group. And in July this year, got invited up to speak about my experience of stigma and research in relation to inequity, so inequality within healthcare, including technology, medication, services within the NHS. Was incredible. It was Drapers Hall in London, which is an incredible building. It was very, very daunting, but again, the team that supported us were so welcoming. I know Jason, I met Jason for the first time. He was here with us tonight at that meeting. And then one of the prevention aspects I got involved with just the last minute in a week or so ago was again in relation to the steering groups and just giving my experience as a type 2 patient of using insulin in acute care, so in a hospital setting, and managing hypoglycemia safely while on a nil by mouth diet due to I was in with severe gastric problems. I love the fact that you can pick up bits and stop. We are looking at trying to set up a community support group near me. Unfortunately, my own health at the moment isn't allowing me to progress with that. But there's so many other aspects that you can dip in and out of. There's micro tasks, that you can see Assemble is a great tool. We've got some training coming up the next few weeks. I can't fault the journey. It's been incredible. I hoped maybe to go hand some flyers out, something like that at the start, and it's just blown my mind. And you can take as little or as much from it as you want. The team will encourage you, support you, guide you, and you can learn how to prevent your own progression through complications, how to support others that are coming through just diagnosed. Just give it a go. And Not the Forum as well is a brilliant tool for getting advice and learning about your illnesses. Just really cannot fault it, and look forward to talking to some of you in the breakout rooms tonight and Have a lovely evening and well done for joining the call. Look forward to talking to you all soon. Take care.
Fantastic. So I'd like to say thank you to Sarah, who is joining us tonight and is going to be in the breakout rooms. Thank you so much, Sarah, for sending us that recording and for sharing your experience of volunteering across our diabetes research steering groups, coming along to our conference and speaking about stigma, tackling inequity, and also prevention. So I'm now going to invite Professor Jason Gill to come and speak a little bit about your volunteering. So I'll just add the spotlight. Here we are, and welcome, Jason. So I'll hand over to you.
Thank you very much. I'm delighted to be here. So I'm Jason Gill. I'm a professor of cardiometabolic health at the University of Glasgow. So I have an academic job. I do teaching and research. My research is around the prevention and management of cardiometabolic diseases, including diabetes. So I do work trying to understand what factors influence risk of developing type 2 diabetes, and why those factors might influence risk of people differently. I heard people talking about ethnic differences in risk, and I saw some things in the chat. So a lot of my work is trying to understand why people of different ethnic groups have different risk of diabetes. And we've done work to show, for example, that if you are South Asian, you develop diabetes at much, much lower body weights than if you are white European. And if you're black, you're kind of in between. So to put this into perspective, if a white European person of white European descent has a body mass index, a BMI of 30, which is where we conventionally talk about obesity starting, someone that's black with a BMI of 26 has about that same risk of diabetes, and a South Asian with a BMI of about 21 or 22. So 21 or 22 for BMI is really very low, and those people have a similar risk of diabetes as a white European with a BMI of 30. So we've done a lot of work trying to understand why that's the case, and we've done work which suggests that there are biological differences in different groups of people which influence risk. For example, we've shown that if you're South Asian, your body's ability to burn fat when you are exercising is a little bit lower. You've got fat cells are a little bit bigger, and these things also influence your risk of diabetes. So I do some work trying to understand that. I also do work to try and understand how to develop interventions or approaches to try and help support people to make lifestyle changes which might influence risk of diabetes in a way that's culturally appropriate and acceptable and something people are prepared to do. So I do that work. One of the things that we find with our prevention programs for diabetes, we talked about the National Diabetes Prevention Program in England, is that they work across ethnic groups, but they work a little bit less well if you're not white European. So the weight loss that you get and the changes in your blood sugar levels are smaller. And one of the things we're trying to explore is whether this is due to biological differences, so that if you're black or if you're South Asian, you might need to do a slightly different type of intervention to prevent diabetes. But it's also the possibility that it's the same intervention, but the interventions aren't tailored in a way which are culturally appropriate for different groups of people. And understanding which of those two is the important factor influences what we do next. So we do some research around that. I, for a few years, have been involved in the Diabetes Strategy Research Group for Prevention and Management of Type 2 Diabetes. I spent about 6 years on the committee, and then I was asked to become chair, and I've been chair of the committee for a couple of years. And I think this is a really valuable and interesting part of my job. One of the really important things is we have a committee which has a combination of doctors and pharmacists and healthcare professionals and scientists, but also people who are experts by experience, the people who have type 2 diabetes. And the bringing together of these two groups means that we're able to address research questions that are directly relevant to people who have diabetes or people at risk of diabetes. And an example which is not strictly relevant for prevention, but is something that our committee put together recently, was one of our committee members mentioned that she had a really rubbish experience when she was diagnosed with diabetes. It was really unsatisfactory. She didn't get the information that she needed. And so what we did is we put together a piece of work to try and understand what people want in terms of their in terms of diagnosis, what information they want and in what way, and also trying to understand with the healthcare professionals why they weren't able to do it, because there's barriers around time and expertise. And so we've put together a large grant application to Diabetes UK to do some work to try and understand why is it that we're not giving people the diagnosis that they deserve, and can we put things in place to make it better that can be rolled out for other people. So that's an example where we're doing research which is trying to make people's with diabetes lives better, but the ideas came directly from people living with diabetes. And so that was a really good example where that sort of research wouldn't have been done, I don't think, in any other setting. I'm just going to do a little bit of an advert. We're looking for new experts by experience to sit on the committee. We've got a number of really good experts by experience, but we need new blood. We need new ideas and new thoughts. We're really friendly. And so if you think that you can contribute, I saw Sarah gave an excellent piece of work how she started off doing sort of relatively small things and made a huge contribution now. We want your expertise, and even if you think that this is something that you maybe think that you're out of your depth with, you're not going to be. We are hugely supportive, so if you want to sign up, then you can get in touch with the Diabetes UK team or get in touch with me, and hopefully we can bring you on board for the team. I think I'll finish off just there.
Thank you, Jason. That's brilliant. What an advert for getting involved, and great to hear the value of experts by experience and people living with diabetes sharing that experience. So I'm sure we can put some details in the chat around about how to get in touch with our research team as well. So keep an eye out for that in the chat. Brilliant. Thank you. Well, finally, I'm going to hand over to Joseph to talk a little bit about your volunteering, Joseph. So over to you.
Thank you, Emily. Hello, everyone. My name is Joseph once again. I'm a micro volunteer and also a community champion volunteer here in Diabetes UK. So I joined Diabetes UK almost about, I think, a year ago. And I've been volunteering with Diabetes UK, going for events, trying to reach out to the community, speak to them concerning prevention of type 2 diabetes, and then also to educate them on what they are supposed to get when they go for their GP visits and then their hospital visits. So I actually joined Diabetes UK because I have a healthcare background, and then I'm also currently doing my master's in diabetes at the University of Chester, which is basically about research in diabetes. So I decided to join Diabetes UK to learn more about diabetes and also to contribute what I can as an individual. So being a micro volunteer has been very rewarding for me, especially because I'm able to combine it with studies and then also with work as a whole. You just share Diabetes UK's information online. We all use social media. Like this is a day and age where social media, everybody is involved with. So I just share these informations. I signpost Diabetes UK information to my followers and then my audience. And then also when I go to the communities, I'm able to share what I have learned in Diabetes UK through some of these online activities that we organize. And then also by the help of Vanessa, I've been able to develop, I would say, passion when it comes to speaking to people who are diagnosed with diabetes. As a healthcare professional, most of the time we are taught in school about just the diagnosis and how to go about it with the treatment. We don't have that human part attached to it. So one of the things that I have learned as a volunteer from Diabetes UK is to be human when you are speaking with someone who is diagnosed with type 2 diabetes or even any type of diabetes. Yeah, you speak with them and then understand them from their point of view and not just give them what they are supposed to know, because they are going through so much that you may not even have an idea of. So it's been quite a rewarding journey. One thing that I have benefited most from this is the know your risk too. Actually, I've been my part of the family, my mom and dad, they all have type 2 diabetes, and then I've lost a lot of family members to type 2 diabetes. So when I found out about it too, I tried it myself, where I got to know that I'm really at higher risk of getting it myself. But one thing I love about it too was it gave what I needed to do in order to prevent me from getting it. And then also it gave me advice on most of the things that I'm supposed to do. It was just sent to me through the mail. So when I found out that thing about it too, I decided to share it also with my online audience, and then also to people that I know. I signpost them, and then a lot of people have reached out to me telling me how beneficial that has been to them. And I think it is something that we all can contribute to when it comes to helping out with the Diabetes UK's mission. We can share these things online whenever we go. We can speak to people about it, and it will be a very good thing for all of us to help bring this whole thing into being. That's a world where diabetes can do no harm. That is something that we all want, and then that is something that we should all do and then work towards. Thank you very much.
That's brilliant. Thank you so much, Joseph. Thank you for sharing about how you shared our prevention messages, our Know Your Risk tool, and those small actions that you've been able to take that have been making a big difference online. So, and Joseph is our volunteer spotlight as well for September. So we will make sure we share that story out with everybody in the post-event communications as well.